I was getting physical therapy at Benson Hall, where I live, a retirement community, and I was talking to my physical therapist, and she said, "You need to get a second opinion." So I said, "Who do I ask?" And she said, "Well, you ask Dr. Vinay Deshmukh." And I was tremendously impressed with him as a person at that time. I found out later what a great surgeon he is.
Helen came to my office, as many patients do, with fairly incapacitating back pain and radiating leg pain. The thing that I remember the most about her, she had a zest for life. And her back pain and her leg pain were absolutely taking that away from her. And I remember her very clearly. She said, "Doc, I want my life back. Can you help me?" So after I saw Helen, we ordered a few different diagnostic tests. And what was very obvious in her workup was that she had a fairly common problem called a lumbar spondylolisthesis. And it's a consequence of just the vectors and the forces of living day-to-day life.
I was in increasing pain for at least 10 years. It cramped my activities because I could not walk for more than a few minutes. And even worse, I developed foot drop.
And in her case, the minimally invasive option is what allowed her to become a candidate for something that generally is considered a fairly reconstructive procedure. Because she was a candidate for minimally invasive, we're able to reduce the risk of the surgery in terms of infection, bleeding, scar tissue. Recovery was shortened.
And I never had another moment of pain after the surgery. Not one moment. I had an appointment with Dr. Deshmukh about 2 weeks ago. It was my 9-month checkup following the surgery. And he did x-rays. And looking at the x-rays, he told me that I had made 12 months worth of progress in the healing in 9 months.
MedStar Georgetown has a tremendous spine program that is unique in many ways. And in particular, the minimally invasive spine program here is one of the leading minimally invasive spine surgery programs in the nation, if not the world. Been at the forefront of developing endoscopic techniques. We've published on endoscopic techniques. We've written a book on endoscopic techniques, and we continue to innovate. I want to say with robotics and arthroplasty, we are truly at the cutting edge. So a lot of the surgery that's happening in the pavilion is robotic, which means more accuracy, more precision, quicker recovery time, less blood loss. And then arthroplasty, which is joint preservation rather than sacrificing joints. And here you have to be a candidate. You have to be within the age group. But arthroplasty is, again, one of our specialties, and we continue to innovate in that space.
I have only the restrictions I put on myself, but the important thing to me is that I don't have pain, because pain not only made it difficult to do things, it interrupted my thinking. It's very hard to think when you're in constant pain, when it never lets up. If I had a friend who was afraid of spine surgery, and in fact, I have had a friend here who was afraid of spine surgery, and I told him how pleased I had been with Dr. Deshmukh's surgery and with the results. For me, it was life-changing. It changed my life entirely.